All right, this is Dr. Rehab Director. I'm back with you, and next week we'll talk about what does an occupational therapist do in a skilled nursing facility. But for this week, I'll just answer a question that I'm asked often. It's a personal question, but why do I like working in a skilled nursing facility? Why not another setting? Oh wait, something's not quite right here. All right. If you don't mind, I'll just change real quick. 1, 2, 3. Much better. So, why do I like working in a skilled nursing facility? First of all, let's remember that in a skilled nursing facility, you have usually two levels of the skilled nursing or that aspect of it. You know, some of them have like an assisted living facility or personal care associated with it, but if you're sticking true to that setting, you got skilled nursing and long-term care. Long-term care are usually the residents who are there, for usually that's their lifetime place, or at least for a few years, or residents who will be at the facility more than 90 days. After 90 days, you're considered a long-term care person. Now, with the skilled nursing aspect of it, that is usually referring to the short-term residents who are usually there for the purpose of some sort of nursing or rehabilitative care, but ultimately the end goal is to return back to the community or whatever location they were at before. So keeping those things in mind, most of the time when I'm thinking of my work environment, I'm thinking of the skilled nursing aspect of it. Because I think that for most of us or most nursing homes, that's usually a big part of it. There are some long-term care nursing homes, or some nursing homes that are primarily long-term care. But a lot of the nursing homes, at least the ones I've worked on, where they are geared toward, the skilled nursing patient, the short-term resident. So again, why do I enjoy it? Well, first of all, I've worked in different settings. I've worked in acute care, I've worked in outpatient, I worked in inpatient rehab facilities, obviously nursing homes as well. And I've also done a little bit of home health and pediatrics. So I've always enjoyed more of the places where I'm in one location. So I don't like to travel that much. So obviously some sort of inpatient environment is something that I'm personally more geared to. So that's in the hospital, that's an inpatient rehab hospital, or that's a skilled nursing facility, outpatient, a central location. So why, out of all those options, did I choose in the skilled nursing facility? First of all, I think that generally speaking, there's a lot more one-on-one time or one-on-one opportunities in a skilled nursing facility as opposed to any of the other settings when it comes to long therapy times. For example, if you're talking about acute care, obviously it's all one-on-one, but the therapy time that you spend with somebody is very short. I think when you're looking at extended therapy times, you're looking primarily at some sort of inpatient rehab facility or inpatient rehab hospital, or you're looking at skilled nursing facilities. So in the inpatient rehab facility, oftentimes there's a lot more room or a lot more push to do concurrent therapy in those settings, and sometimes groups. Skilled nursing facilities offer themselves to the same opportunity there, but in general, the majority of the treatment is one-on-one. So I enjoy that because it gives a lot more time to provide individualized treatment to a resident if you're just seeing them at this one particular time. And also it allows more time for creativity within each treatment session because of that. You're not having to juggle most of the time, and that I really enjoy that part of it. I'd say the most. I also enjoy the skilled nursing facility area because you tend to have a lot more time with the residents overall, in the sense that in most of the settings, if you're looking at acute care, by the time you're done with your eval, the next time you want to go see them, the person may or may not be there. Inpatient rehab facilities, generally speaking, you're looking at about a 2-week stay, sometimes a little bit more, but there's usually a big push for that certain type of patient that's going to go in there and go back to the community. Whereas in a skilled nursing facility, they're usually a little bit more stable, so they're usually not going back to the hospital once they get to you. And the fact that they're there means that they probably will need a little bit more help for a longer period of time. So they might be at your facility, even if it's a short-term resident, for more than a few weeks. Sometimes it could be a month or so. There are some facilities where the resident might end up staying there, or maybe they come in there in your facility for the purpose of staying there long-term care. And in those cases, you're kind of involved with that resident for a much longer period of time. You might see them while they're skilled being 5 days a week or more. And then they come unskilled, where they might be off therapy altogether, or they might be on some sort of restorative or maintenance program, or they might be followed by you still under OT for a non-skilled intervention, a Medicare B or Part B intervention, usually 3 times a week or so. And during that time period, you're working on certain goals. You might adjust as needed, but then if they're in that building and they're there for months or years, at some point you're going to probably see them again, because they're going to have a new opportunity, because there's been maybe some progression, or maybe there's been some a decline in their function, or something new comes up that you're able to kind of return and work with this resident. So it gives a good opportunity to share a lot more with the residents and their families, and to kind of appreciate their long-term progression, because they're there. You see them when they first started, and maybe their body needed some rest, and after a couple months they start getting better, and you see them again, and you kind of see them still continuing on their improvement phase. And also, it kind of allows you to get to know them more. So down the road, if there is some sort of decline, you kind of know what this person needs to do on a regular basis, or what they're like. So it allows you to hopefully be a little bit more efficient with what we deliver to them, or what we try to plan out for this person, based on their goals as well. For occupational therapy and just therapy in general, I think that there's also more opportunities to be involved in the continuum of care, or with the team in a skilled nursing facility. A, because you're there for a longer time period, and B, sometimes the things that we're trying to do at this type of setting are things that take time. For example, if you're trying to get them a power wheelchair, there's forms that have to be filled out. The doctor has to recommend it. We have to take measurements. We have to submit our recommendations, letters of necessity, so forth. So these are things that can take a few weeks, sometimes even months. Same thing with, like, if you're dealing with a prosthetic, an amputee. The orthosists have to come. They come out. They measure. The wound has to heal. The residual limb has to heal. So there are things that, just by nature of the medical condition that they're dealing with, they take their course, they take their time. So we're involved in more of those aspects. Sometimes we have to, we might discharge him because the prosthetic limb isn't there, and then in a few weeks when it comes back in, we evaluate, and then we work with them with the limb. And so sometimes there's residents that are there for short-term or long-term, and they're going to go back to the community. So it allows us to do a little bit more community integration items, including home evaluations. I think of all the settings I've worked in the skilled nursing area, has been where I've had the most opportunities to do home evaluations. Primarily because, if you're looking at an inpatient rehab facility, they're there for a short period of time. Sometimes they're going to let the home health team or the skilled nursing team do that based on just for the sake of time. And two, the other reason is because when they're at a long-term care facility and they have progressed, and it's taking them months, sometimes years, to get their community resources in place, this person is usually going to a new environment, or their environment has been adapted. So now we have to go and make sure that whatever environment they're going to is appropriate for them. So I have enjoyed that much as well for that part. Um, Also, education of staff. I think that in the skilled nursing area, there's a lot more opportunities to educate staff as far as the rest of the team goes, and even within the therapy department, so educating each other, in servicing each other, and also in servicing the staff. The backbone of a skilled nursing facility is obviously the nursing team, the CNAs and the nurses, and uh, based on our areas of expertise, they rely on us heavily for things like orthotics, positioning, even educating on different type of complex transfers, trying to assess, the person's ability to take care of themselves or feed themselves or, use a restroom, get themselves prepared, and so forth. So there's a lot more opportunity for that also because in any environment you have, a turnover, and usually the CNA core in any environment, especially inpatient rehab or skilled nursing facility, there's a level of attrition there. Sometimes it's for good reasons. Sometimes that position is something that people are doing to gain experience, or as they're working on to become a nurse or to become some other part of the healthcare sector. So there's attrition there, and we're given the opportunity to educate new staff, right, or refresh staff on certain things that are very rehab oriented. Sometimes, like for example, working with a hemiplegic patient. As a therapist, for the most part in that setting, we know what to do, we know what not to do, hopefully, right? And sometimes the staff on the nursing side doesn't have that same level of expertise with how to reposition the hemiplegic person. You don't pull on their arm. It's a flaccid hand, flaccid upper extremity. You don't want to do that. So there's little subtleties or little technicalities that we live and breathe every day, and we are given the opportunity to share that information. And at the same time, there's a lot of expertise from the CNA and the nursing staff that they can return to us as well. So educating staff, depending on where you're working at, if you're working primarily long-term care facility, you won't see it as much. But if you're in a facility that's primarily skilled nursing, short-term oriented, then you will see a pretty good variety of diagnoses. Sometimes people say, well, you work in a nursing home, you're not going to see that much. But in reality, you do see a lot of different things, where you're talking about neuro, ortho, trauma. You can get a good opportunity to see a variety of very interesting cases. And again, it just depends on where you're working. If you're working at a skilled nursing facility where they have they're fed by major hospitals that have a lot of complex cases, more than likely that's the type of resident that you're going to be getting. If your specific facility is fed by mostly an orthopedic type of hospital, then that's probably what you're going to end up seeing mostly. And that's up to you as an individual to kind of position yourself in a setting or an environment that you feel is going to be the most rewarding for you. So let me see now. So what are some of the challenges? Yeah, why do you want to work in a skilled nursing facility? It smells bad, and there are some facilities that do, but those are usually not the ones I want to work in, right? And hopefully neither do you. But, what are some of the things that people, say are challenges of working in a skilled nursing facility? Usually there's less staff. I think that I always tell people, if you're a new grad, you have an opportunity, I'd say, work in inpatient rehab or work in a skilled nursing facility that's big and has a lot of staff. Because usually a skilled nursing facility is going to have fewer staff on the PT, OT, and speech side. So, if you're trying to learn or you're trying to bounce ideas off, you probably have a smaller pool to work with. And they also have usually less staff than in a hospital. Even if a hospital has the same amount of beds that a skilled nursing facility, the staffing ratio is different in the hospital. They have more nursing, more CNAs than a skilled nursing facility. So the amount of staff that's there to tend to that patient or to get them ready is obviously fewer or less than in an inpatient rehab hospital. Obviously, there's less resources. You're looking at inpatient rehab facility, an inpatient rehab hospital. They are dealing with these residents really early on, so they might have much more equipment or newer equipment because they're funded better than a skilled nursing facility, because that's all they're doing all the time, right? Now, I think in therapy in general and in most environments, there's a pressure for productivity. I think in the skilled nursing environment, obviously there's some pressure there. You want to be efficient, and I'll have another video about that, later on. But there's productivity pressure there. Sometimes there's pressure to keep people on longer than they need to be, or if a long-term care resident, for example, goes out because their labs are off, but they're fine physically, there's no other things going on, they're out to the hospital 3-4 days, they come back, there might be that, they might reset them or try to reskill them. They might not have the nursing needs, so they'll look at therapy and say, hey, can you pick them up for therapy? Wink, wink, right? But again, if you're in a good facility, that's not going to affect what you're going to do. Regardless of what facility you're in, I tell everybody, it's your license, it's yours to protect, and what you do with it has to be justifiable and appropriate. So never feel pressured, no matter what someone's telling you or where you're at, to do something that's unethical or illegal. There's never an excuse for that. At the end of the day, you're responsible for your own license, no matter where you are, and you want to do the things that are appropriate. So if you're making good, sound clinical decisions, you'll be fine. What's important to understand is that at the skilled nursing facility, you're looking at somebody at a different level. And sometimes I see people that come from like outpatient, or acute care, and they can't make that adjustment. In an outpatient, you're looking at somebody who's primarily pretty able-bodied. They're high level, as we call them. So it's important that, if you go to a skilled nursing facility, you see somebody who's a little bit worse off, as a therapist, if you don't have that experience, you might say, wow, what am I going to do with them? They're not appropriate, quote unquote. But that's usually not the case. Usually the case is that the therapist needs to adjust what they're looking for. Somebody is dependent for, getting up from the bed to mobilize themselves, to get themselves ready. And you're saying that, your goal is for them to be modified independent for cooking. We're not there yet. So it's not really a level of appropriateness. It's a level of the therapist is just not calibrating their goals, correctly. So I think that it's much easier to go to an environment like acute care or outpatient and make that adjustment, because in reality, it was like, wow, this is much easier. This person can do all these things. Whereas I feel that staff that primarily works at those other levels has a harder time adjusting to the long-term care or skilled nursing side, because unless they can make that adjustment, they kind of become tunnel visioned and say, well, what am I going to do with this person? Well, we got to start with the fundamentals, the basics. They're not going to go cooking if they can barely sit upright. We got to work on their trunk, work on their sitting tolerance, work on their reaching, dynamic sitting, and move up from there. Now, in a skilled nursing facility, we also have a lot of patients who are higher functioning, and we do get the opportunity to do those other things with them as well, right? So, again, regardless of the environment, protect your license. It's your livelihood. If we're working, that means that we need income for ourselves, our family. It's our livelihood. In my experience, I have to say that most of the times I've been asked to do something that's not appropriate, it hasn't been from ill-intended. It's usually because the person that's asking you this doesn't know what you're allowed to do within your scope or what you're not allowed to do. Or they don't have the experience to know what the discipline does. So it's always important to just educate them and let them know, well, this is why I can't do that. This is, this person's at their baseline. There's nothing else that's going on. I cannot provide therapy services for something that's not really, doesn't demand my level of expertise. So most of the time you'll educate people and you'll be fine, and that comes with experience. I know for the newer people that's harder to do. Sometimes they don't even know what they're supposed to or not supposed to do. But use your network, find those people that you can trust, that whether they work there or not at the facility you're in, can guide you and making the right decisions there. I think one of the biggest challenges I find in any nursing home that I've ever been to is usually related to the carryover of the interventions from the therapy side to the floor for the duration of the person's stay. A lot of it comes from attrition. Sometimes they lose staff. Sometimes it's communication. Different facilities have different ways of communicating what orthotics a resident has to wear, how they transfer. Some of them do it electronically, some of them do it on paper. There's different ways of that communication taking place. Again, in a skilled nursing environment, you have 3 different shifts, just like you would in a hospital, but the staff is usually very different as well. Sometimes that staff doesn't rotate to the daylight shift. So the information that's there is sometimes difficult to carry it over to all the shifts. Sometimes they have different assignments. If you're working at a nursing home with different floors, different units. Sometimes you'll train a certain amount of staff at this unit, and then in the next couple of weeks they might be at a different unit or on a different floor. So now you got to retrain all these other people, and finally when you've trained everybody, then the staff changes, and it can be a bit of a cycle. And then obviously, because residents are there for a long time, the long-term care ones, you tend to see some residents a little bit more than others, because some of them have conditions that are degenerative in nature. Some of them have issues that put them at risk for falls, and then they fall and they might injure themselves. You might have to see them after that. So sometimes there's a cyclic kind of nature to it, or residents that kind of go to the community, but then they make their way back to you because they have different situations or similar situations until they finally make that decision that they can't be in the community. Again, some of the things are personal to me. So next week, like I said, the next video will be on what specific things an occupational therapist does in a skilled nursing facility. Between now and then, feel free to ask me questions about the skilled nursing facility, myths, rumors that you might have heard, or maybe more details as to why I don't enjoy some of the other settings as much as a skilled nursing facility. I think all of the issues that I might have brought up are things that are very manageable with good communication, good leadership between you and the therapy department, you and the director of nursing, and the other departments in the skilled nursing facility. There's definitely ways to manage all those potential things. Like any setting is going to have its strengths and weaknesses. But I definitely encourage you to consider that as one of the settings that you might decide to work on, whether you do it as a full-time or PRN. But until next time, I look forward to seeing you and hearing your questions. Please feel free to send me any message or any question. I'll be glad to address it in future videos. Again, if you have an idea for future videos, also send me that information. For now, please make sure you hit the like and subscribe button, and I look forward to seeing your comments and for your future input. All right, again, this is Dr. Rehab Director signing off.